Respected judges and dear colleagues, today's paper, Glaucoma Staging Based on Mean Deviation of 24-2 Visual Field under its Severity in Visual Field Defect. Now, the purpose of this study to evaluate the accuracy of the mean deviation glaucoma staging system for classifying the severity of common glaucomatous visual field defects, particularly in central and peripheral defects in early glaucoma, and to assess the agreement between the mean deviation staging and existing two staging system, Hoda, Paris, Anderson, and glaucoma staging system 2 for classifying glaucoma severity. This retrospective cross-sectional study reviewed the records of 661 patients' data from 2008 to 2019, and we included 86 eyes of 72 patients with 4 common initial glaucomatous visual field defects, namely nasal defects, then central paracentral defect, partial arcuate defect, and arcuate defect. Now, all these included visual fields were graded initially by the mean deviation staging system and subsequently by 2 other classification systems, HPA and GSS2. Finally, the result of these 3 classification systems were compared. Now, these are the all staging systems. The mean deviation staging system entirely depends on the mean deviation scale, has the following 4 stages. Now, we adopted modified Hoda-Paris-Anderson system, and it has 2 main parameters, the mean deviation and the loss of threshold sensitivity within the central 5 degree of the visual field. HPA classification has 3 stages. Now, GSS2 plots the mean deviation on the x-axis and pattern standard deviation on the y-axis. The intersection between mean deviation and pattern standard deviation value defines its stage ranging from 0 to 4 according to severity. Now, in this study, the most common type of defect was nasal defect, 39.6%, then 26.7% partial arcuate, next was 23.3% central paracentral defect, and 0.5% arcuate defect. Please note here that the mean deviation staging and HPA staging classified almost equal percent of visual field defects at stage 1 and stage 2. However, the GSS2 staging was very dissimilar from both the mean deviation staging and the HPA staging. With 5 subdivisions, GSS2 had wider options for a detailed categorization of the visual field defects with a range from staging 0 to severe disease, so any possibility of misclassification is kept to the list by GSS2 staging. Now, table 3 shows the classification of disease severity of common glaucomatous visual field defects in early glaucoma by 3 existing classification systems. Now, we have noticed that the discrepancies among staging system in peripheral and central common glaucomatous visual field defects. First, we should consider the peripheral one. When 70% of the nasal and arcuate-like defects were classified by early or stage 1 by mean deviation and HPA staging system, GSS2 classified only 17% of the nasal defects, 11% of the arcuate defect, and 21% of the partial arcuate defect as early disease. Now, we observed the major difference among the staging system in classifying glaucomatous central visual field defects. All 20 eyes with central paracentral defect were classified as stage 1 or early disease by mean deviation staging. However, this classification was entirely different from the other 2 classifications. Here we see that is a central paracentral defect. Now, disagreement among all 3 staging systems for classifying this visual field defect, where mean deviation staging classified is as stage 1 and Hoda-Paris-Anderson classified is stage 3, whereas GSS2 classified it as stage 2. Now, Venn diagram illustrates the excellent agreement between mean deviation staging and HPA staging and poor agreement between GSS2 staging and mean deviation staging. Here is a chart shows the agreement-disagreement among staging system for assessing severity in central peripheral common glaucomatous visual field defect. In first row, we find it is a central paracentral defect. Here we find the agreement between mean deviation staging and GSS2 staging, but disagreement with HPA. Now, please note that this visual field defect with central paracentral defect was classified as stage 3 or severe disease by HPA. Why? Because HPA considers the abnormalities within the central 5 degree of the 24-2 visual field grid. Now, second row, we find an arcuate defect with high pattern standard deviation value 11.2. Now, agreement here we find it's the agreement between mean deviation staging and HPA staging, but disagreement with GSS2. Now, none of the eyes with arcuate-like defect in this research was classified as severe disease by mean deviation staging and HPA staging, but GSS2 classified 33% of the eyes with arcuate-like defect as severe disease, as GSS2 considered both mean deviation and pattern standard deviation for staging. Now, among three staging systems, only the HPA considers the threshold sensitivity of abnormal visual field point within the central 5 degree for staging the glaucoma severity. Now, hence, HPA staging classified 15% of the central paracentral defect as stage 3 or severe disease. Central paracentral defect were grossly underrated by mean deviation staging, and GSS2 staging as a damage within the central 5 degree was not considered by this method. Mores et al., they also observed that the current glaucoma staging system misjudged disease severity in the presence of
you
central...
have to pause for a second. ये 5 मिनट हुए, 6 हुआ है, 6 हो चुके.
नहीं 5 के बाद 1 हुआ था, पर बीप तो हुआ नहीं, वो तो अब हुआ है ना. मैंने आपको बोला था 5 पे बीप करिए ताकि स्पीकर को पता चले कि 5 मिनट हुआ है. 6 पे
आपने
तो
शुरू में
बीप
5 लगाया था ना इस पे.
नहीं, पर आप बीप तो 5 पे दोगे ना भैया.
1 मिनट पहले एक निशान.
एक बीप दो आप 5
No, you
मिनट.
quickly wind up, otherwise it will be over.
Mores et al. Observed that the current glaucoma staging system misjudged disease severity in the presence of central visual field defect in early glaucoma. So we could conclude that these findings suggest that the current glaucoma staging system, especially mean deviation staging, grossly underrates disease severity in visual field defects with defects within the central 5 degree and also nasal and arcuate-like peripheral visual field defects. GSS2 performed better for classifying nasal and arcuate-like defect. Hoda-Paris-Anderson staging performed better for classifying central visual field defect. A standardized staging system should be considered by clinician and researcher for quantifying both central and peripheral early glaucomatous defect to systemize the treatment. These are my references. Thank you.
Nice paper, Tutul, but you exceeded your time. Anyway, you tell me the question. Who studied these?
Sir, I studied it.
You studied, but this is not mentioned in this. No? There was a single leader for all these things and single person doing all this staging.
Yes, sir. This is a limitation. I did the whole.
Okay.